All right, hello everyone. This is Dr. Joel Rosen. I call myself the Adrenal Fatigue Recovery Ninja, and I am back once again with a real mentor of mine, Dr. Michael Johnson, who's taken the time out of his busy practice to tell us all about what to do when the medications stop working, and give you a lot of useful information on how you can recover with a chronic condition problem. So Mike, thanks so much for being here today. I really appreciate it.
Thank you, Joel. Appreciate it.
Yeah. So you had reached out to me the other day and asked me how I was doing with the exhausted, burnt out patients that I'm working with, and mentioned that there's some really cool things out there that can really help them that I don't know about, or I do know about, but don't know how they could be utilized to the best abilities. And so I want to get into that with you today, Michael, but can you just tell the audience a little bit about you and who you are and what you do and what makes you tick, so to speak, so they can get a little idea on that?
Sure. So I've been in practice since 1983, practicing chiropractor. I started here in Appleton, Wisconsin. A couple of years ago, we started into stem cell because stem cell really helped me with my MS. This is about 1997, I got into the chiropractic neurology program. So just as there are medical neurologists, there are chiropractic neurologists, we call them functional neurologists. I wrote a couple books. One of the books is What Do You Do When the Medications Don't Work? And so yeah, I'm pretty passionate, just as you are, helping people. I've always said there are so many millions of people out there that need help. There just aren't enough good doctors. And just throwing drugs at the situation, which, as you know, with adrenal fatigue, most doctors don't even recognize it. They don't even know what the term is. They tell patients, and we have a few adrenal fatigue, not as many as you, obviously, but go out and exercise, eat better, and you'll be fine. And that's really not the case. So, yeah.
Yeah, and also that you're depressed or you're anxious.
Oh God, yes. Yeah, you have anxiety. Yeah, you need that. That's what I love. Yeah. You need more meds. That's what you need. You need selective serotonin reuptake inhibitor or something like that. Yeah.
Yeah, and you know it's crazy now too, Mike, when I do the genetic reports and you look at the pathways and seeing how they're set up to clear out transmitters and the medications that they're on is in the wrong arena.
Right.
It's not even on the areas that need to be supported.
Right. And I did a video on this. You do a lot of videos. I do a lot of videos. Put them up on YouTube. And, one of the reasons that MDs don't like me is because I'm so vocal that they are just driven by big pharma. I mean, there's drug reps in their office every week telling them what to do because I have drug reps as patients. We just had a new one that signed up. She goes, yeah, that's exactly what I do. I walk into the medical doctor's office, tell them what they should be doing, and then they do it like a robot. It's crazy.
Yeah. Well, I think, as you've always said, is it's an acute-based model.
Yeah.
And when you have a chronic-based condition and you have multifactorial components, and you're not going to medicate yourself to good health. And so I have a lot of your sound bites programmed in my head.
Yeah.
But getting to the head and talking about functional neurology, let's talk about how you use that in your practice and how does that even relate to people that have a chronic fatigue or an exhaustion or burnt out problem?
Sure. So one of the things that we developed, and it came across this way. So, we do stem cell. We have a lot of MS patients. We have a lot of stroke patients. We had a patient, Gail, and we have a video testimonial. After 3 weeks of care, she was speaking better and walking better. Part of the reason was because that we were using PEMF on her head, pulsed electromagnetic field therapy. And so much so that I started using it, and it helped me. And then other patients, we got them on it. And then pretty much now we've got everybody utilizing it. It's a home unit. They can use it at home. It's not as expensive, so if there are people out there that can't afford stem cell therapy, obviously they could use this, and it will give them some help. It helps with fatigue because it works at the mitochondrial level, And as you know, the mitochondria, and I've talked about it, are the powerhouses in the cell. So that's where you really want to work with the patient. So it's pulsed electromagnetic field therapy. And we have large $35,000 units in our office we use with patients. But now there's a portable unit, and it works extremely well. So well, like I said, we're using it with all of our patients to help increase firing of brain. In the past, as a functional neurologist, what we would do are, brain-based exercises, looking at something or spinning in a chair or auditory stim. The PEMF unit placed on the head in the right area is so much more powerful. And then we use it with our kidney patients. They can put it on the kidney acupuncture points, or heart patient on the heart point, or lung patients on the lung acupuncture point. And then finally, in your realm, and that's why we're here, adrenal patients, fatigue patients. So what we do is we put it on the adrenal points and on the head because the brain controls every bodily function. Your frontal lobe fires down to the brainstem, vagus nerve. You've talked about that. I've seen some of your videos. We kind of watch each other. And yeah, it's really an incredible unit. It really is.
Yeah. So just summarizing, and I've always said this too, is I want to change my name sort of to the mitochondrial fatigue ninja, because the adrenal ninja just doesn't capture all the things that are going on. And really, the system, the brain communicates to the glands, and then the glands, impact different tissues. So you have it as an orchestra system, but really what makes up the system is each and every tissue or each and every cell of the body. And when you boil it down to the cellular level, we're really talking about the body's ability to make energy. And so you don't just have an adrenal problem per se, you have a brain-based problem, you have an oxygen utilization problem, you have a detox problem, you have a repair and regenerate problem. Whatever your body needs for currency to be able to be made and purchased in the body requires mitochondrial health. So as far as with people with this PEMF, because I've heard of it, but I haven't really used it as much as you have, as far as what you were mentioning, that you just can't go out and necessarily hack the body by purchasing it. So tell us why that's even important, why I wouldn't just go out and buy one myself and just use it myself.
Well, you're not going to get the best benefit out of it. Everyone knows stress decreases firing of brain. So when people get totally stressed out, the brain shrinks. So you got to know exactly where to place it on the head and then on the body for maximum benefit. And then that'll change. I mean, let me just show you real quick if I can do this. I don't know if you can read it, but what PEMF does, pulsed electromagnetic field, it increases endorphins to help pain. It increases energy by increasing mitochondrial function. It increases brain, nerve, and tissue regeneration. It improves immunity, better oxygenation, better sleep, increased growth hormone, builds stronger bones, decrease inflammation, and increase cell voltage. So a tremendous benefit. And it's just a little unit. This is what the unit looks like. So it's battery operated. I recommend a rechargeable battery. The beautiful thing about this unit is once we figure out where the patient needs it, we can actually go in and measure and gauge. It's called the brain gauge. Cortical Metrics has it, and we can measure their brain function. And then in a month, remeasure it, and then every month thereafter. And it kind of looks like this, where let's get you a good example. Here's a TBI, severe traumatic brain injury patient. Green is good. So this is the original. This is 2 weeks later, and this is 1 month later. Now, that's not going to happen in every case, but it's going to gradually increase frequency of firing of brain. As you increase frequency of firing of brain controls every bodily system. You're going to be healthier. You're going to be happier. It helps with fatigue. It helps with depression. It helps with anxiety. It helps with balance and coordinated movement. So all these things are the benefit. And what the brain gauge looks like, It's just this unit right here, and you can see it's just this portable little mouse, and it vibrates. And the reason that they're using the hand, sorry, I've got all this stuff. I'm really excited about this. We had some remarkable patient changes. I mean, it's incredible. But this is the somatotopic map. And up above, that gray area is the motor strip. If I slice it and open it up, you can see the hand has such a large representation here. And that's why they're using the hand to measure the brain. And that's out of my book. So yeah, it's really been incredible, to the point where, as I mentioned with Gail, she came in initially upon presentation with multiple system atrophy. It's a severe form of Parkinson's. She couldn't speak. She would just grunt. And now she's speaking. I just had a conversation with her when she was in the office yesterday. So that's exciting. It really is.
So, okay, so just to recap, you have this region in the brain that is a geographical map of the body. And,
yes.
And you can take a starting objective measurement based on what's going on with the biggest representation in the brain as measured by the hand. And then how does it actually get a starting value, Mike? What does it actually do?
What's the baseline? Yes. So the testing, and that's what you want to do. It's called cortical metrics brain gauge. You could just do it for one time. It's like $30. If you do it for 6 months, it's like $19 a month. But what you're doing, yeah, you have to get that baseline. You want to make sure this thing is working, right? So actually, this was a study that was done by the developers of the PEMF unit, and also the developer of the brain gauge, and then also William Pollack. Maybe you've heard of him, Joel, maybe not. He's big in the PEMF. He's a medical doctor. And we're actually to the point where we're going to be doing some research with Dr. Dennis, who developed the PEMF unit, and Dr. Tommerdahl, who developed the brain gauge. So how you get that baseline is just that initial testing. And it's very simple test. You have your hand, 2 fingers, index finger, middle finger on the mouse, and it'll be asking you questions, and it'll vibrate. Which one did you feel first? Which one was stronger? Different things like that. And we're getting baselines in our office now on all of our patients. And the beautiful thing is there's that home unit. And I said you can do it one time for $29, or you can do it 6 times for $19 a month, and monitor yourself. And you don't have to come to Appleton or go to Boca Raton to check yourself. And so then you consult with me. We have a couple options: 6 months, 3 months, and we find out where we're going to place this. And part of it is based on that brain gauge. And part of it is what I know from neurology. So it works for the patient's best benefit. So back to your question, Joel. Sure, anybody could go buy the thing, but you're not going to get the best benefit out of it. And normally when people don't see a benefit, they're going to stick it in the drawer, and that's the end of it. And so, yeah, if you're going to get it, utilize it and improve your body. It's going to give you more energy. It's going to help boost your adrenals. Like I said, there's so many positives with PEMF, and they don't have to believe me. They can just Google pulsed electromagnetic field therapy. And this is definitely the most, or the least expensive unit with the most power. It's the unit that I can only see that you can use on your head and the body. So it's a huge win for everybody. And just, you name the condition, and it's right there. We just use it across the board with all of our patients.
Yeah, it's really encouraging. And as far as I've heard you talk about it too, we're not talking about hocus pocus fly-by-night developer, right? We're talking about this doctor who's been commissioned by NASA. So what's the story there?
Dr. Robert Dennis, you're right. He developed this technology for NASA. He's a neuroscientist at the University of North Carolina at Raleigh. And yeah, the guy is just super smart. And he came up with this, and he'll even tell you it's the shape of the wave, the shape of the pulse, because as I'm sure you know, EMFs, electromagnetic fields, are detrimental to your health. In front of a computer, Wi-Fi, microwave radiation, cell phone towers, which is microwave radiation, but pulsed electromagnetic field therapy with the changing waves, and that's what you'll notice with this machine. You'll hear it clicking, and the clicking will change. That's the wavelength changing, and it's very beneficial and great for healing. And I'm telling you, if you really want to heal your body, you're just wiped out, lack of energy. I know you have a lot. You're the adrenal fatigue ninja, but this is really something added to their healing that actually works, and they can see it work, and that's the beauty.
Yeah, no, it's really cool because I talk to a lot of people that have that fight or flight, overwhelm, sympathetic, can't get out of overwhelm, and then unfortunately they get on GABA support, and those are just nightmares coming off. So this would be, in theory, really great for the anxious patients and
anxiety. Yes, I mean, a lot of those people had literally post-traumatic stress disorder. They had so much stress sometime in their life, the switch hit, as you know. And so that's the beauty of this machine. You apply it right to brain, and it's going to help you. And it's going to help you a great deal. And here's the thing. So because we're doing this with you, and we want to help your group, we offer a money-back guarantee. So 6 month, no question asked money-back guarantee. Now, if they tell us when they contact us that they're with your group, we'll actually give them an extra month. So that's how we know they came from Dr. Joel. And we'll also give them an extra month in working with them. So, but you got to say you're with Dr. Joel so we can make sure you're in the right group. And we're not making this offer, and you can see my videos on YouTube. We're not making that offer anywhere else. So. Right.
So as far as, again, just if I was the skeptic and I'm thinking, well, putting some pulsed EMF on my head, and what about if I put it over my heart and I got a pacemaker, or I'm just kind of, so perfect. What's the there?
So if you have a pacemaker, this is not for you. But in most people with a pacemaker already know that. Right. Any other side effects? None. The only other side effect is if you used it too long, you might get more fatigue. So don't use it too long. That's where I come in helping you based on the brain gauge and what I know about neurology to assist you in using it properly. So,
gotcha. So, okay. And then I just was wrapping my brain around when people are exhausted and burnt out and mitochondrial health is fatiguing. Basically, a lot of that energy, Mike, correct me if I'm wrong, just goes into the ion pumps in terms of pumping minerals to and out of the cell for voltage and so forth. Yeah. And I guess that's really what it's doing at its core, is it not? Is it helping with the exchange of nutrients into and out of the cell when the cells just get so tired that
that's just it. Normal cell voltage, as I'm sure you know, 70 to 100 millivolts. And when you're sick, when you're fatigued, when you have cancer, it's around 15 to 30 millivolts. So PEMF actually increases that electrical charge. And that's really, really the benefit. There's a Dr. Tennant, who's a medical doctor. He's big in the cell voltage. He's totally on board with PEMF. I mean, PEMF has been featured on Dr. Oz. The problem is all of these units are around $5,000 or $6,000 for the home unit. They're not inexpensive. You can't use it on the brain. The brain controls every bodily function. Here's a unit that you can get anywhere from, depending on the option that you take, anywhere from $800 to $2,000. And the $2,000 includes blood work. Now, most of your people you're working with them, they already have the blood work. So then it's just a matter of how long you'd like to work with us to make sure this thing is working well for you.
Gotcha. Okay. And then also just because I think it's almost the dirty secret that most major PEMF companies don't want you to know about is that this home unit that has a battery pack and can be as low as, $800
Right.
is just, so what's the difference? Is there an output in terms of time, or it takes more
No,
time to get the same
there is
benefit?
absolutely no difference. None. Now, the companies, like we have each one of our units in our office, I've been doing this since 2014. They were $35,000 each. We have 7 units. So, their selling point was, well, more power. More power is not necessary. This is low and slow. You want this at a low setting, maybe a medium setting. You don't want it at high or extra high. And it's just a little switch. It's very easy to operate, and just low, and then just use it a little longer, and you gradually work up to it depending on where it's placed on the brain. Let me give you one example. When we worked with Gail, and this is so exciting, we put it on her Broca's speech area, which is right here in the left frontal lobe. After 15 minutes of using that portable PEMF unit, she was talking like I am to you. And she hadn't been able to talk because of the multiple system atrophy. Now she's making progress. So what we did, we had to learn the hard way. I'm like, okay, 15 minutes is great. Put it on there an hour. I mean, it just cooked her. It was way too much. It fatigued her. So I had to learn the hard way that you just have to go gradual. And especially when you have adrenal fatigue patients. We don't see the patient volume of adrenal fatigue like you do, Joel, but we have about a half dozen, 6 patients with adrenal fatigue. That's what they're seeing us for, getting stem cell. And every one of them is on this unit, and they're all doing fabulously. I mean, it's something they can do every day at home, and it's making a huge difference. It really is.
Yeah, when you told me about it, I was like, okay, Mike, I got to interview you and figure out how we can offer this. So just to, again, summarize,
Sure.
with my demographic, as you've mentioned, they've identified themselves as being stressed out, burnt out,
Right.
just overwhelmed with tasks and demands and deadlines. And they just don't bounce back the way that they used to. They crash in the middle of the day. They can't focus. They have a lot of problems with finding the words that they want to express themselves.
Right.
And quite frankly, they also have other problems that are brain-based, right? Because at the end of the day, the mitochondria is not working great. Okay, so let's say that I want to do this, but you're in Wisconsin and I'm in Boca Raton, but I may be in another part of the country. How does it work in terms of, do you work them up in terms of figuring out, like, okay, what are you dealing with? And then, like, tell me what different opportunities you have here.
So what we have to the patients that we've worked with so far, and I really have to limit how many I work with every month because we're busy with our stem cell. So what we do is they just email me a brief history. It gives me some idea, and based on their symptoms, I can pick up in the brain what's going on just from doing this for the last 21 years as a chiropractic neurologist. And I already have, the minute they give me that brief history, an idea of how I'm going to use it with them. So then they just pick which option, and we'll go over the 3 options here shortly. They have a form we fill out. They just get it back to my staff. My staff sends it to them. They'll get the unit within a week or 2. Just depends on where we're at with it. And then we start. And I'll make the recommendations. I have a video. It's not on my YouTube channel because it is a very in-depth video of how to use the machine and how to use the O-rings in certain situations for maximum benefit. So, talking about self-hacking, what you're getting when you're hiring me is I've already worked through all the intricacies. I've already did the failures like I did with Gail, and I know what works and what doesn't work. So you're cutting right to the quick. So you can go out and buy another unit somewhere else. That's great, but good luck figuring out how to get the maximum benefit. And even Dr. Dennis and Dr. Tomerdahl will tell you this is how they intended for this unit to be used. Not just self-hacking it, but somebody who actually knows what they're doing with it and can teach other people how to use it effectively. So that's the beauty.
Right, right. So, okay. So basically I would, if I'm interested, I would email you a brief history, tell you what's going on. And then what you do is you look at the fact that the different areas of the brain that are responsible for focus, concentration, memory, learning, cognitive balance, temperature, physical pain.
Let me give you an example. You mentioned someone having something on the tip of their tongue and they can't get it out and they can't communicate it. Let me just go over that real briefly. Well, Broca's speech area is in the left frontal lobe. That allows you to communicate. It allows me to speak to you. Wernicke's area is in the left parietal lobe. That allows you to understand what's being said to you. And there's a connection, the arcuate fasciculus, that connects those two. So a lot of times when people have things on the tip of their tongue and they can't get it out, the problem is in this area. Not every time, but most of the time. Sometimes the problem is in the cerebellum. Cerebellum is the back part of the brain. It controls your balance and coordinated movement, controls all the spinal muscles. Sometimes it's the cerebellum that needs to fire up to that left frontal lobe. So you put it back on the right cerebellum. Again, it depends on the individual. No two people are the same, as you know, working with patients. And that's what makes all the difference in the world.
Gotcha. Okay. So then, but not only that, you're not just saying, hey, include what you're starting with at the beginning, but we have to commensurate this as you start to have improvements and feedback. So how does that work?
Excellent. Yeah. So yes, this isn't static. Your brain is dynamic. It's fluid. Your brain is plastic. It's malleable. You can move. It changes. So up until 20 years ago, they thought, well, the neurons, once they're dead, they're gone. You can't bring them back. That's not true. The PEMF unit helps bring back those neurons. So what you want to do is, yes, every month, ideally for about 6 months, you get on that brain gauge and you can see the change. Now, based on what we're going to see, obviously, let me just go back to this example. This one right here with this severe TBI case, and you can see all the green over here. Obviously, this is going to be a different setup even 2 weeks later or a month later, and even here. So it's not perfect here yet, but that's going to be a change compared to what this is here. Now, there are some instances, I think that's a rather extreme case, that much change in a month. I don't think you're going to see that much change. Most people have such severe stress that their brains have shrunk that it may take a few months. But yes, we want to go back at least once a month, once every 6 weeks, and we're re-examining the patient to determine where we're going to place those. I call them O-rings, they call them coils, and how you're going to place them. So part of it is, I'll just show you this briefly. There are ridges on one side and it's smooth on the other. So placing these together or alongside the body, ridge up, smooth side up, there are a lot of intricacies with it. And that's why you want someone like me to guide you to get the maximum benefit in the shortest amount of time. And you know what?
Okay, great.
6 months, if it doesn't work for you, send it back. We'll give you your money.
I mean, you got to be pretty confident, Mike, to know like, hey, listen, I've seen enough of these where this is a technology that helps with your basic ability to produce energy. And if we do it in such a way where I understand how your brain works and the connection to it, we're not going to have you return it because we're going to see these improvements.
Look, this is something, honestly, I've been using it for some time. I'm going to use it the rest of my life. Because where do you go anywhere in the world where there's absolutely no stress? Maybe Boca Raton, Florida, but you know, because it's minus 20 degrees up here in Appleton, Wisconsin. But where are you going to go where there isn't stress? We all have stress. So how do you adapt to it? And how do you, allow your body to heal at maximum effort? That's where this unit comes in. We have hundreds of units out there. Not a one has come back, nor I doubt if any will. But if patients feel so inclined, and in your case, since they're coming from you and they have to tell me that in the email, they'll get an additional month of consulting with me and an additional month on the money back guarantee. So it's actually, they can use it for 7 months and make sure it works for them. And if it doesn't work after 7 months, send it back because you're in Dr. Joel's program. We'll give you a money back guarantee.
That's awesome. Thank you for doing that. I always get you guys on the call to give special deals, but I wasn't anticipating that. So
Well,
as far as, that's great.
Joel,
So
you and I go way back, right?
right.
Way back. We've known each other since forever, it seems like, which is a good thing. And
right.
we're always in, we won't hear from each other in a while, and then I'll text you, hey, how's it going? Good, how you doing? And so we're just constantly bouncing. What do you think about this? I don't know. What do you think about that? So we're constantly bouncing things back and forth. So yeah, I'm happy to do it for your group, and they aren't going to find me doing it anywhere else. I can guarantee you that.
Right. Oh, no, I appreciate that. So, okay, so I'll have it posted in the video underneath this so that they'll have it specifically in written words.
Oh,
so they
good
can
idea. Yeah.
Yeah, but in the meantime, so I know you have a couple of different entry points.
Let me give you the options. Yeah. I'll do that. So it's, in your case, 7-month money back guarantee. Option number 1, it's the good option. You get the PEMF unit, 3 months working with me to assure maximum healing, $795. Option number 2 is the better. It's going to be working with me 6 months for $1195. And in both those cases, it'll be 4 months and 7 months for your group. And then finally, the best recommendation, option number 3, get the unit, you get complete blood work if they don't already have it. And that's $1995, which is a bargain because I normally charge $2,500 for blood work. And there's the email, mljohnson@askdrjohnson.com. You got to give me a brief history. Let me know you're with Dr. Joel, and then we can go from there.
Awesome. So, okay, so summarizing, we got a 3-month deal, $795. They get 3 months of consulting with an extra month of 4 months of 4 months of consulting plus a 4-month guarantee. If they don't feel it works, they send it back. Then the second one is 6 months of get the unit, 7 months of consulting, and 7 months or 6 months of consulting, 7 months to return it back. Basically, is that what it is?
7 months of consulting and 7-month money back guarantee. So we're adding a month.
Okay.
Adding a month. Yeah.
And then the last one is you're actually including up to $2,500 worth of testing if insurance were to bill their or insurance was to bill for blood tests. And that includes like comprehensive thyroid. You also have a couple of hormones on there too, right?
Yeah, pregnenolone and big time. I think, as you know, pregnenolone is a master hormone. So we look at that with everybody. Vitamin D, complete metabolic panel, looking at all your internal organs, inflammation markers, homocysteine, ferritin, fibrinogen, C-reactive protein, complete lipid panel, a CBC with autodifferential. So you're looking at red and white blood cells. So it's the complete blood work that we do in our office. And actually, I'll be honest with you, we had a patient go and have the blood work done over here at the hospital. They charged her $3,500 because she wanted her insurance to pay for it. And guess what? Her insurance didn't pay for it because a chiropractor ordered it. She didn't go through her medical doctor, and she got stuck with the bill. And I told her, don't do that. We include it in our care plans, but oh well, that's life.
Right. So if that option with the 6 months with the complete blood work the 7 months of consulting and the 7 months of
I don't mean
guarantee.
to confuse you. We're just adding an extra month. That's all.
Extra month, exactly. We're just, the only difference between that program and the one below it is you get the blood work basically as well, right?
Yeah.
Okay.
Yep.
All right. Okay, great. And then how do they go about doing that? I'm going to put it in the link, but they email you at, what's the email address?
Yep. mljohnson@askdrjohnson.com. It's right there in blue. And they could just shoot me an email, give me their brief history, let me know what option they want, or if they have a question, I don't know what option to take, not a problem. We'll give them the information on the brain gauge if they want to get a baseline. They could just do the brain gauge one time if they like. It's $29, but you're going to get really a lot of information from it. And then they could come back in 6 months or whenever they'd like, and then retest, and it's only $60. So,
how does the brain gauge get sent to them, and it's a one-time thing? How does that work?
You know what? I've got to talk to Mark about that. They do have a home unit, and even if it's the one-time thing, I think that is how it works. But look here's what the brain gauge measures. Let's just cover this briefly. And this is their research paper that they did. And I can send your patients that if they'd like. But look at what it measures. It measures focus, speed, fatigue, accuracy, sequencing, time perception, plasticity, and then connectivity. That's what you're measuring with that brain gauge. It's a great instrument. Like I said, we're getting a baseline on all of our patients with it.
Okay, cool. All right. So, and again, I would tell the listener that I don't offer this. I could offer the PEMF, but I don't have my diplomate in neurology, even though I have some hours. So I'm not going to be Dr. Mike and tell you, okay, this area of the brain wants to be paired with this area, and you're offering 4, 7, and 7 months of very important coaching and consulting in this.
And that's unlimited. So they'll have my cell number. They can text me, they can call me, they can email me. So yeah.
Right.
I mean, I've been doing this, like I said, I've been in practice since 1983. I've been in the neurology program since 1997. I can figure it out in just a very short time what the patient needs. So, yeah.
Okay, so here, I don't want to put you on the spot, but I do have 7,000 people in the Facebook group.
Yeah.
I have 43,000 people in the page. I have just over 6 not on the YouTube, and then about 12 on the emailing list. And because it's such a good deal, Mike, I want to send it on all those social medias, but I'm afraid that I'll flood you. So is there a limited time or a limited amount of people that you're going to do this for?
Well, yeah, we can only accept so many people a month. So it's first come, first served. And honestly, my staff and I talked about this yesterday. We have a meeting every Thursday at noon because I knew I was getting on the call with you today. And we have a number, and we're going to cut it off at that number. And then either people will have to wait till next month, or we'll put them on a list when we can get to them. So sooner is better. Put it that way.
Okay. Yeah. Don't lose out. Don't hold. And okay. So, and then lastly, it's just ask Michael, what's the email one more time?
Sure. ML Johnson at askdrjohnson.com.
Okay, great. And then just, if you want that extra month and that extra month of consulting and
to get that, you got to say you're with Dr. Joel. That just put in, I'm with Dr. Rosen, I'm with Dr. Joel, and we'll get it done.
Right.
Before, like I said, we knew this was coming up. We brainstormed it, so we're ready, and we know how to handle the situation. We have a form, so they will email me. If they have questions, I'll answer them. I will email them the order form. They can email it or fax back to my staff. We'll get it right out to them.
Right. That's awesome. That's really, thank you for doing that. And then the last thing is, if someone is in the States, they will ask, because I get this all the time, well, how do I go about doing the blood test? So how would they go about doing that?
Yeah. So we use LabCorp. Do you use LabCorp? I'm not sure who you use.
I do. I use Professional Co-op, but I'm going just to
LabCorp. That's exactly who we use, Professional Co-op. And so LabCorp has draw sites all over the country. So we just have them go to a draw site near them. The only problem we've had with LabCorp is North Dakota. So if you're in North Dakota, you may have to drive a little bit to get to the LabCorp. So other than that,
and New York too, right? I think New York is always a bit of a sticky state too.
Well, the thing with New York though, Joel, the beautiful thing there is we have a nurse practitioner on staff, and she can order in New York. So we can get around that. Yeah. So it works.
Okay. And then I do have people overseas that obviously couldn't do the blood draw unless they came somewhere here, but are you able to ship overseas? How do you do that?
Yeah, we're able to ship overseas. We just, we wouldn't be able to do option 3. And we have that situation with our stem cell patients. We have a lot of patients from overseas. As a matter of fact, we got one coming from Dubai on Monday. And so, we couldn't do the blood work over there, so they're going to be doing it here on Monday. So, that's the only difference.
Right. And that's really, Mike, you really are a mentor to me. You have been for a long time, and I've learned a lot of things from you, both professionally and personally. But I think one of the things that sticks out to me in this is you looked and you said, hey, listen, we get a lot of tremendous success with stem cells. Everyone understands it, but it's just sometimes out of the price range for people
Right.
that can't manage it. And the opportunity gap is, hey, listen, there's something that's really awesome that's out there that can help you, and it's not going to break the bank, and you need to know about this. And I'm always trying to help other people get what they want, and then that will help me get what I want, so to speak. And this is what you're offering, right?
Well, exactly. And I mean, that's exactly how this came about. I get hundreds of emails, I'm sure you do too, every week. And a large part of that is, I can't swing the stem cell. It's pretty pricey for me right now. Is there something I can do? And this is something they can do to really help themselves.
No, that's really great. I appreciate that, Michael. So what I'm going to do is I will definitely post this into the different media sites, and then let me know how it goes with who responds and how that goes for you, because I'm excited to hear the results of this.
I'll keep you posted, my friend.
All right, awesome. Thanks for joining us, and we'll talk to you soon.
Thanks everyone for listening. Appreciate it.